At present, the world is,
2.
at present, the world is being tossed with the plague of what could be called the terrible one. After all, almost all countries in the world are keenly aware of this one, the coronavirus, otherwise known as COVID-19. Every day, the news media keep up to date on the virus, whether it is on television, the internet, newspapers, and other news media. The honorable judges, let me introduce myself. I'm Chen Masyhud Al Haq from Mu'allim Muhammadiyah Boarding School. I'm going to deliver my speech about behind the COVID-19. COVID-19 first spread across the city of Wuhan, China. Soon after a few weeks, this virus has spread across several countries. To some news sites, it has claimed that more than 180 countries are infected with the virus. Initially, it gives rise to symptoms such as the common flu, sore throats, and fever. However, if left without immediate medical attention, this could lead to what many people do not want, death. Apart from the effect felt by the infected, the virus also has a huge effect on human life. Where at present human beings are strictly limited to one another's interactions. Almost all of Indonesia, schools and colleges turn learning methods into online systems. In addition, many physical economic have been halted. Some companies have applied employment work from home to their employees. Many obstacles there, but especially among students, it's not much good in rural areas. When students are required to study online, as they currently are, indirectly they are also required to be ready always to be active. And this certainly requires good service quotas and constant coverage. While not every student has adequate quotas of support signals, even some of them don't get regular loans when going to college or school. As for lower middle class people, such as public transportation, small roadside stores, they feel a lack of income is due to the large number of people going about their business as usual. On the other hand, however, there was a palette of medical supplies such as masks, hand sanitizer, alcohol, and the like. The aim was none other than business. They made the process worthwhile and made the most of the profits. From March to the present time, the pandemic has had a lot of impact on the lives of many, including children. Some of the children may be doubted three risk outcomes of the COVID-19 pandemic that potentially affect children. These risks are the result of uncertainty and perceived changes caused by the pandemic. These risks come from online surveys involving 11,000 parents and 4,000 teachers in Indonesia, together with of other secondary data. The survey was made in 10 to 27 April 2020. Here are three risks effects for children. 1. The loss of a parent's livelihood. As is known, the COVID-19 pandemic has affected many things, including domestic economics. Surveys found that as many as 72% of respondents suffered from pandemic's loss of income, making it difficult to meet daily needs. In fact, 32% of respondents lost their jobs. 2. Nutrition. Without income, many families struggle with obtaining healthy food. The number of stunted children and poor nutrition is expected to increase. And child obesity can increase because consumption of processed foods. 3. It's hard to access basic healthy service. The economic impact at home levels greatly affect meeting a child's basic needs, ranging from food to health service. Surveys found about 77 households could not get proper in food income. That means about 60 million 0 to 17-year-old children are forced to eat less than they should. Rest of the children. This is how the COVID-19 will affect children in Indonesia, which is the first case of the COVID-19 in March. And today, Indonesia has one of the highest rates of infection in Asia. Without immediate action, the COVID-19 impact on children will be profound and lifelong. Assalamualaikum warahmatullahi wabarakatuh.